So is avoiding the sun actually more dangerous than being in it? One of the stories on the podcast was about the teenager boy who had lung disease. Can you tell us a little bit about that story?
He was diagnosed with lymphoblastic lymphoma, leukemia, I should say, back in October of 2024. The doctors were coming to them and saying, you're going to die in 2 days. And there's really not much we can do. So they basically got to the point where they were asking him what was his last wish to do. And he says, look, I just want to get outside. They got him outside the first day for about 5 hours. The next day, fever was gone. The white blood cell count had come down. He got better, and it was actually coming off of all of his supplemental oxygen. The doctors were baffled. We've been told for a long time that the sun is a deadly laser and we should avoid at all costs sunlight for 15, 20, 30 minutes a day in a type of light where there's not a lot of ultraviolet or excessive ultraviolet radiation certainly has benefits.
Why should we be getting this 20 to 30 minutes a day?
Yeah, so there's multiple reasons.
Feeling confident in your skin is so much more than what you see in the mirror.
And how can you feel good? Well, that starts from within.
Welcome to the In Your Skin podcast. I'm Christy.
And I'm Anna. Join us each week as we sit down with world-leading experts and thought leaders to delve into the latest insights, groundbreaking research, and cutting-edge advancements in wellness, longevity, and beauty. Dr. Roger Seheult, it is so nice to have you on In Your Skin. Thank you for joining us. Now, I don't want to do you an injustice with who you are. So if you could just let us know who you are and what you do, that would be great.
Sure, yeah. I'm a pulmonary doctor, so that means a lung doctor. I'm also a critical care doctor, so I take care of people in the intensive care unit. I'm also a sleep specialist as well, so I see patients in the clinic and help them to sleep better. And I've been doing this for about 25 years. I've been a physician for about 25 years. About 13 years ago, we started a education channel on YouTube called MedCram. And this is to educate physicians, students, respiratory therapists, nurses. And during the pandemic, we expanded out, talked a little bit more about wellness and some of the things that you can do from a natural standpoint to also fight illness and to maintain a robust immune system. And we looked at a lot of things with evidence. So we've sort of been out in the front looking at evidence and things that people can do in their daily lives to improve their immunity and their well-being.
Yeah, well, one of the reasons why I wanted to have you on this podcast is because I heard you on another podcast. And one of the stories on the podcast was about the teenager boy who had lung disease. And to me, it was quite shocking. It was just one of those moments I was like, wow, I can't believe this could happen. And for it to be such a serious illness and to be, I guess you could say, whether or not you could say cured by sunlight, but healed, I guess could be a better word, by sunlight. It was a story that I told multiple friends. I was like, you've got to listen to this podcast because it's quite incredible. So can you tell us a little bit about that story?
Yeah, so I have been discovering this whole issue about sunlight and its benefits probably back in 2022, with a paper that I read from Russell Ryder and Scott Zimmerman that really opened my eyes in terms of how sunlight is much more than just an avenue to get vitamin D. And as I started to talk more and more about that on podcasts and getting out there, there was a lady that contacted me, Amy Honmeyer, who's the mom, and she says, you got to sit down and listen to this story about what happened to my son. And she says, you would not believe it. In fact, she sent me the medical records. So I went over the medical records of this boy and looked at the CT scans. I actually had the CT scans, looked at the medical notes and the dates and everything, put it all together. It's what I do actually in terms of looking over patients' records and things when I take care of them in the intensive care unit. So it's not something new that I was doing there, but it was quite incredible. Basically, he was diagnosed with lymphoblastic lymphoma, leukemia, I should say, back in October of 2024, and was on chemotherapy. Now, when that happens, your immune system becomes compromised and you're open up to infections that you would not normally be open to. And that's exactly what happened in June of 2024. Sorry, I said October of, let's see, this is 25. Yeah, so this would have been over a year ago. So June of 2024 is when he was hospitalized. Now, at that time, he just entered into the hospital, had some illness, pneumonia. They found it kept getting worse, though, which was very unusual. And despite antibiotics and antifungals, they finally did a diagnostic bronchoscopy where it's a tube that goes into the lungs and actually gets a sample. And they found that it was this very aggressive fungus that likes to eat flesh. And it basically follows wherever the blood goes, and it just eats it and for nutrients. And very, very powerful antifungal medications for people who know what that is. They'd be like amphotericin B, posaconazole. These are the most powerful antifungal medications that we have on the planet. And they were using everything they possibly could. But despite that, it was getting worse. It was cavitating, which means that there was a collection of this stuff in a concentrated area where the blood supply was not getting to. And that's a problem. If you're giving antifungals into the blood intravenously, obviously it'll only go where the blood is going. And if there's a pocket that's sort of walled off from that blood supply, you're not going to be able to get to it. And the only solution there is to remove that tissue. And so on July 1st, which was about a month later after being admitted, he had surgery where they actually removed his left lung. And hopefully they were hoping that was going to take care of the infection. He was going to get better. He didn't. So at this point, he's already in the hospital for 4 weeks. He's already out of the sunlight for 4 weeks. He's not getting any of those beneficial rays that we can talk about the evidence for that now, based on some research that has come out just recently. And he started developing that same fungus in the other lung. And he was getting worse, having fevers, high white counts. And obviously the doctors were very concerned because this is his one remaining lung. He certainly obviously can't do surgery on that. He needs lungs to live. There's a number of things that they could do to sort of support him, like put him on a ventilator or put him on a heart-lung machine, things of that nature. But there's no bridge. It was a bridge to nowhere because he wasn't getting better. And so they had a big conference. This is what Amy was trying to summarize to me. It was difficult for her because she was reliving it as she was talking about it. And, how do you talk to a 15-year-old boy who's awake, alert, oriented, and able to understand what you're telling them? And the doctors were coming to them and saying, you're going to die in 2 days. And there's really not much we can do. We don't think we should put you on a ventilator. We don't think we should do all these things because it's not going to change the outcome. So it was clear to me in reading the medical records that they had done everything they possibly could, everything they possibly knew how to do. All of the medications, all of the training, all of the stones were overturned and looked at in terms of everything they could possibly do. And so they basically got to the point where they were asking him what was his last wish to do. And as heartbreaking as it was, they asked him this, and he says, look, I just want to get outside. So I can tell you as a healthcare provider, if someone comes to you and you've done everything that you possibly can, and they have one last request, that's the one thing that you're going to do the best that you possibly can do. And they did. To their credit, they took a very sick child who was on, different types of support, including a BiPAP machine, which is kind of what you wear as a mask to help you breathe. And they were able to get him packed up into sort of like a bed type structure outside into the sunlight. There's actually video of this on that podcast that Amy was able to share. I actually got a hold of Amy and put her in touch with the podcast so that she could supply exactly what photos she wanted to do. I mean, she's trying to maintain her privacy a little bit here. She understands that really can't be maintained completely, but she's trying to do the best that she can, at the same time trying to get the word out of what happened to her son. So it was amazing when they got him outside. They got him outside the first day for about 5 hours. At that time, he had a fever. He had a very elevated white blood cell count, which was not good. It shows that the immune system was fighting the infection. And went back inside. The next day, fever was gone. The white blood cell count had come down. He was feeling a little better. Stayed out there for a few hours. And this went on and past 2 days. And to make a long story short, at the end of 5 or 6 days, he got better. And it was actually coming off of all of this supplemental oxygen. And the doctors were baffled. So they said, well, this is a great sign. This is a good turnaround. They had just done a CT scan of his chest prior to that. And that's what they came up to this conclusion, that he was not getting better. He was not going to get better because the left lung was completely gone. The right lung was very enlarged, not enlarged, but involved with this fungal infection. And if you were to look at it, the right lung, which is the remaining lung, The upper lobe was completely involved. The lower lobe was not. The middle lobe was. So it was like 2/3 of the lung was involved. And of course, the left lung's gone completely. So when he was doing better, they decided to get another CAT scan. And Amy tells me they were all in the room when the screen came up with the CT scan results, and they were looking at it. And there was a gasp that went out throughout the room when they saw it. It was a dramatic improvement. I would say, if I were to put a number on it, probably 60 to 70% of the infiltrates that they saw on the right side of the chest in the remaining lung was gone. And he was doing better. So this was a head scratcher, but they continued to allow him to go outside and do this. Obviously, it was working. By October of that year, there was absolutely no sign of the fungal infection at all in his remaining right lung. He was actually able to get back on chemotherapy. And just recently, I understand he got his Make-A-Wish completed, doing well as far as I'm aware, and doing well. And really, looking back at that, the only thing that really had changed was that he went outside in the sun. Now, there was this device called a Firefly, which gives off different wavelengths of light that they were trying on him in the hospital intermittently. They did it a little bit more consistently for about 5 minutes a day. I don't know how much of that made an impact on what he was doing. But in either case, it was either sunlight or light from this Firefly. So in either case, the only difference between what he was doing in the hospital and what he was doing on those days was that he was simply outside. He was still getting the same antibiotics, the same antifungals, the same treatment, the same BiPAP. Everything was the same.
Incredible.
Yeah, it's incredible. It literally seems like it was the missing link.
Yeah.
Since telling your story, have hospitals sort of taken notice of this? Have you seen any changes in hospitals when it comes to taking either patients outside or putting them closer to windows?
I don't know if there's been any changes. I do know that in my discussions with people around the country, around the world, there are hospitals even now that still continue to do this. And this is a practice that goes back over 100 years. There are hospitals that back in the 1800s, if you know, like Florence Nightingale was a big proponent of getting patients outside. Of course, she's the founder of modern nursing. So this was something that actually was very widespread and was done on a regular basis. And there are some, believe it or not, someone just sent me a photograph of a hospital in South Africa that has a beautiful veranda around it. And to this day, patients that are admitted to that hospital get taken out on that veranda. It's just part of what they do. There are hospitals in the United States that do this. But of course, let's not fool ourselves. The majority of hospitals that are built today don't have as part of the regular treatment of patients getting out in the sun. And that's something I would love to change. There's plenty of data that shows that patients that are closer to the window get discharged faster. And this is in multiple patients, not just depression and bipolar. This is also in post-op orthopedic surgery patients. This is in MICU patients. Windows that are larger have bigger views. Those patients have better outcomes. We have now randomized controlled trial data that shows that patients with COVID admitted to a hospital and they were just getting 15 minutes of infrared light a day. Were discharged from the hospital instead of 12 days on average, but 8 days. So cutting off 4 days of hospitalization, randomized controlled trial data, statistically significant. We have data now out of England, University College London, Glenn Jeffrey's work that shows that infrared light penetrates right through the human body, and it can have effects on the mitochondria that are distal from the path of the light going through the body. Another study that was randomized looking at our infrared light from light bulbs in people who are working in an LED environment that actually improves vision in those patients, in those subjects. All randomized controlled trial data, all published in very worthy journals by top researchers from around the world. So the data is coming out, and I believe we ought to be acting on this data.
It's incredible, isn't it? And you're just like, why don't we have more of it? But I guess it's as the research comes out, hopefully more and more hospitals will be implementing these things.
Yeah, I think one of the reasons why is we've been taught, and there's been a lot of research in this area looking at ultraviolet light and the risk of skin cancer. So there's this risk benefit ratio, and we've been told for a long time that the sun is a deadly laser and we should avoid it at all costs. And I'm not here to tell you that we should just go out into the sun and spend hours out there and you'll be fine. We don't want sunburns. We don't want skin cancer. We don't want melanoma. But at the same time, it's very clear that sunlight for 15, 20, 30 minutes a day in a type of light where there's not a lot of ultraviolet or excessive ultraviolet radiation certainly has benefits. And so the discussion really ought to be not, it's a one-sided risk-only situation. It's got to look at the benefits and the risks. It's got to look at individuals. It's got to look at where you are on the globe and what kind of skin color you have, because all of those are going to play a mix into what your risks are.
Yeah, 100%. I mean, we're in Australia and the sun can be pretty harsh here, and we are always drilled into us to avoid the sun at all costs and putting the sunscreen on. But can you talk us through maybe some of the benefits of sunlight? Why should we be getting this 20 to 30 minutes a day?
Yeah, so there's multiple reasons. We can talk, number one, about circadian rhythm. We can talk, number two, about mood. And finally, number three, we can talk about metabolic health. So let's talk about circadian rhythm. Circadian rhythm is the clock that really times all of the processes in your body. There are certain processes that happen during the day that have to happen in coordination. And there are other processes that happen at night that need to occur in coordination. You can think about it this way. I live here in Southern California. We have a park called Disneyland. I have a friend that used to work at Disneyland at night, and he would tell me all sorts of things that would happen at night. There was gardeners, there were people, engineers on the rides. All of these things had to happen at night because there was no visitors in the park. And that's the time ideally that you'd want to do this, so that when the park opens at 8 o'clock the next morning, it's ready for the next cohort of people that are going to go into the park and enjoy it. The body is far more complicated than Disneyland, right? So during the day, you're active, the sun is out, you're eating. Those metabolic processes are completely different than the metabolic processes that you would have happen during the night. And so what the sunlight does when you go out into the sun during the day is it entrains that circadian rhythm to make sure that those processes are occurring at the right time. If you don't get enough sunlight during the day, or you get too much light at night, those processes can become confused. And it's kind of like the gardener showing up in front of It's a Small World, or the engineer shutting down the rides at Space Mountain during the day. It's gonna cause chaos and havoc. And in a human body where systems need to work well, it causes people to die earlier. And that's exactly what the data shows. There was a study that was published in the proceeds of the National Academy of Sciences called Dark Days and Bright Nights. And what it shows is very specifically is that not enough light during the day or too much light at night actually shortens your lifespan. So light and daylight in the daytime, like literally going outside, not staying inside, not being under lights, that's not good enough. You actually have to be outside. That's one of the benefits of it. So that's circadian. What about mood? A lot of people who live in extreme latitudes will have this period during the wintertime where you get up before the sun does and you get home after the sun goes down. And there's a lot of people, particularly women, who get susceptible to something called seasonal affective disorder. If you don't have enough light getting into your eyes, there's a part of your brain called the perihabenular nucleus, which doesn't get enough stimulation, and it's going to cause depression. And so what you may see if you go online, you can buy these lights that are about 10,000 lux, and you can put them in front of your face, about 11 to 16 inches, was about 30 centimeters. And you are sit in front of it for about 20 minutes a day. In the morning time, if you're getting up before the sun does, that can help a great deal in mitigating the effect of a seasonal affective disorder. So if that's not something that you have, or that's not an issue in the summertime and you can get outside, that's going to be even more effective than even those SAD lights, or seasonal affective disorder lights.
Would that work as well for people that are working night shifts and sleeping most of the day, or?
Yeah, so that it could. There's a whole host of issues with people who work during the night, and that's a circadian rhythm issue. So with respect to people who are working at night, if you are working at night, the best thing to do would be to get up every single night and to sleep every single day, so that your circadian rhythm is always in that way. What the problem happens is when you do day shift for a few days and then night shift and then go back to day shift, that's more problematic. So if someone is going to be night shift the whole time, they will always be waking up at night, even if they're not working. then yes, that can be very beneficial because it's going to entrain the circadian rhythm to be on the other side of the world, so to speak. In other words, you're 12 hours out of sync.
But they won't be getting the sunlight that they need.
Correct.
Though.
Correct. Okay. So that sad light is only really good for depression and for perhaps starting the circadian rhythm at the right time. So those are the first two things that we talked about. There's another aspect of sunlight that goes beyond circadian rhythm and goes beyond depression and anxiety and these sorts of things. And that is something that is just emerging. And a lot of people don't know about it. I would even say probably your local physician has no understanding about this because the data for this is just coming out now in the last 2 to 3 years. And here's what it is. There is an aspect of sunlight that you cannot see. It's called the infrared spectrum. It's beyond red. You cannot see it with the naked eye, but you can feel it. It's that aspect of the sun that's very warm. Okay. It's the warmth that you feel. It's able to penetrate through your clothes. So if you're outside in the sun and you feel that warmth through your clothes, that's the type of light that we're talking about, infrared light. Not only does it penetrate through your clothes, it penetrates through your body, and it actually interacts in the cells of your body with something called mitochondria, which are the powerhouses of the cell. And when it hits those mitochondria, it upregulates the energy, it upregulates the metabolism, which is at the core of the problem, by the way, when this doesn't happen, to chronic diseases like cardiac disease, dementia, diabetes, obesity. So a lot of the diseases that we see in a modern world is that of a reduced mitochondrial metabolism. What sunlight does to this is it upregulates it and reverses it in a sense, so that there's more metabolism. There's more ATP, which is the product of the mitochondria. And what this does is it has so many different aspects of endpoints that depending on where the mitochondria are in your body that's actually getting affected by this, you'll have different outcomes. So let me explain a little bit more about why we are so sure about this. There was a study that was published in Scientific Reports, Nature Scientific Reports, which is a pretty prestigious journal, published by a professor of ophthalmology at University College London by the name of Glenn Jeffrey. He had a number of colleagues on this, like Bob Fosbury, who's an astrophysicist, and the rest of his colleagues there who are working on this. What he did was he took somebody outside during the day, and he was able to measure the spectrum of light coming into this person. And he was able to detect on the other side of their thorax, 30 centimeters deep, on the other side, he was able to detect that there was infrared light that was penetrating through the entire body, albeit a very small amount coming out the other side, but nevertheless see what the spectrum of that light was. And he found that the maximum wavelength that was coming through that patient was 850 nanometers, which is beyond our red. We can't see that. So then what he did was he brought these subjects inside and he illuminated them with infrared light just at 850 nanometers. And he was able to do a couple of things with that. Number one, just by irradiating them here in the chest and the body, the upper body, he was able to improve their vision of color in their retina. So they were able to see better, distinguish between colors better. And that's important because the back of the retina is very rich in mitochondria, and this is exactly what we would expect to see. Now, the next part of this study was really incredible because he did it again, except he covered their face so that the light could not hit the retina. He still noticed that there was a benefit, even when the light was hitting the chest, that the mitochondria somehow were able to communicate with the mitochondria here and upregulate their metabolism so that you don't have to expose even all of your body or even the part of the body that you want to be exposed to get the benefits of infrared light from the sun.
Well, that's good to know, actually, because sometimes when I am working from home, I'll go sit outside to get that, 30 minutes a day of sunlight. And I'm like, I've only got my legs out. So I'm still getting enough then to help improve my mitochondria. Would that be right?
Yes, not only that, but if you're outside and you're surrounded by a number of green trees or greenery, that's also, those leaves are highly reflective of infrared light. You may have noticed this. If you ever go outside on a hot day and felt the leaves of the trees, do they feel hot?
No.
They don't. And it's because they're reflecting very highly the infrared light that normally heats things up. So if these leaves, if you were to look with an infrared camera at leaves, you can even do this. Go to the internet and go to Google and just type in infrared photography. You will see that the leaves of trees, the grass, all of this lights up extremely brightly because the infrared light from the sun, when it hits it, it doesn't stay on it. It doesn't get absorbed. It doesn't heat up. It comes and reflects right back onto you. And so if you are in an environment where you're surrounded by green trees or grass, you are going to get even more illuminated by infrared light, which is very beneficial. And we've known for a long time that people who live in green spaces actually do much better. They have a reduced incidence of diabetes. They have a reduced incidence of all-cause mortality. They do much, much better.
Could you just substitute going out and being in the sunlight with just going in an infrared sauna?
That's a good question. So when Glenn Jeffrey looked at his data and saw which was it that actually improved vision better, was it the specific wavelength of 850 nanometers, or was it an incandescent light bulb, which gives you all of the wavelengths that are past red? In other words, is it one wavelength particular, or is it all of them together? He found that it was all of them together that seemed to do the best job. So what I would say is the number one thing that I think is the best for getting the maximal benefit from infrared radiation is sunlight, because that has all of the wavelengths in it. And it's perfectly balanced and designed. By the way, it's got ultraviolet in there too. And ultraviolet is very important for vitamin D. One of the other benefits of sunlight is vitamin D, and that comes from ultraviolet radiation. I understand, of course, in Australia that you have much higher levels of ultraviolet, and so that has to be mitigated. But nevertheless, it seems as though a broad spectrum of infrared light is better than just an infrared sauna, which is going to be at 1 or 2 or maybe even 3 wavelengths. Obviously, though, if you don't have access to that, if you live in a very northern or southern latitude where you don't get out, you have the opportunity to get outside, and you don't want to just be sitting in front of a sad light, you want to get some of that benefit of infrared light, then doing a sauna may be beneficial in terms of that. Yeah.
And before you were talking about, or Chrissy was saying how she just gets a little bit of sunlight on her legs. I've heard that getting sunlight on your entire body is better than just getting a bit of sunlight on your legs. Is that correct? Like you need sunlight on your entire body?
Well, I think what we see here based on the work of Glenn Jeffrey is that it doesn't have to be the whole body to get benefits. Let me give you another study that Glenn Jeffrey did. He took red light, which is 670 nanometer light, and did it just on their back. So I would say about 30 centimeters by 30 centimeters. It was a red light panel that was just about 30 centimeters by 30 centimeters. And after doing that, they gave a glucose tolerance test. So everybody's glucose spikes after you get a glucose tolerance test, right? Those that had the red light on and the subjects did not know whether they were on or off, so it was blinded, those had statistically significantly about 27% reduction in the spike of their glucose. Obviously, their glucose is a systemic issue, right? It's a systemic thing that determines how your glucose is and what your metabolism is and what your insulin resistance is. And just using a portion of their back in terms of red light was enough to make that change. So I can tell you this, I don't think you need to have all of your body exposed to light to get the benefits from it, but it's possible that the more light you have exposed, the faster you will see the effects of that light.
And with infrared saunas and different types of red lights that you could get, what is the optimal amount? Because you were talking about numbers before. You said 850. Like, can you explain a little bit about that? So what should we be looking for if we are wanting to go shop and buy this red light for us?
Yeah, so this is the problem. The problem is that so much work goes into, let me give you an example. There was a study that was done in Brazil where they took COVID patients and they admitted them to the hospital and they got 15 minutes of infrared light to their chest. And they did that test at 940 nanometers, okay? And it turned out wonderful. They chopped off 4 days off their hospital admission. Here's the question. Would that work at 939 nanometers? This is the wavelength of light that they used. What about 900? What about 850? And the answer is we don't know. We don't know is there an optimal wavelength that this happens at? Does it just need to be within a certain range? The amount of energy that they used in that study was 2.9 milliwatts per square centimeter. Should it have been 5? Should it have been 10? You can imagine, you could pick one study, you could do 100 different repeats of that study at different wavelengths and different intensities. And then you would try to figure out exactly what was the optimal, but then it would be the optimal for that particular condition in that particular type of patient population. And you could see very clearly that we could literally spend the next 100 years trying to figure out which wavelength is the right one. The bottom line to your question is we don't know. So we don't know if we ought to be looking for 1070 or 850 or 940. What I can tell you is that those are the wavelengths that I see over and over again in a lot of these studies that seem to be beneficial. So I would say if I were in the market for an infrared sauna, those are the types of wavelengths that I would want to see. But I don't know if someone comes up with one that's, let's say, 1,000. Does that one work better? I don't have any data, so I don't know the answer to that.
And we've kind of touched on vitamin D a little bit, but when it comes to sunlight, people might just want to go substitute with vitamin D supplements. And I think I heard the study of how many people were deficient was like in vitamin D was out of control. Is it because they're not getting enough sunlight, and can they just substitute with vitamin D supplements?
Excellent question. First of all, we have to understand that vitamin D is a hormone. We have to understand that vitamin D has to be metabolized after it is made in the human body. So there's two ways you could get vitamin D. You can get it made in your skin through ultraviolet B radiation, or you could get it basically ingested and absorbed through your gut by eating things that are rich in vitamin D, things like mushrooms, things like fish, things of that nature. Or supplements. Realize that it takes about a week or two for that vitamin D to be metabolized into the active form. First of all, the liver has to put a hydroxy group on there in the 25 position. And then at the 1 position, the kidney puts the final hydroxyl group. And now you have 125 dihydroxy vitamin D. That is the active form. And that's what does a lot of the work. That's what helps with immunity. That's what helps with bone. That helps with all of these things. You can't take the active form and ingest it and expect that it's going to work. There is more active form called calcifediol. It's prescription strength. There are some studies that seem to indicate that its active form is a little bit faster than the regular vitamin D. But there is a time lapse. So the other question is we see a lot of studies, especially during COVID, that show that people with good vitamin D levels did better and people with poor vitamin D levels did worse. That was an associative study. We don't know if they were doing something else that caused them to have a good vitamin D level and also would have at the same time caused them to get better. So we gave a lot of vitamin D during the pandemic to patients that came into the hospital. It didn't seem to work very well, but could it have been that we gave it too late? Could it have been that we didn't give the right dose? Could it have been that we didn't give the active form? All of those are possibilities. What I'm seeing is even in patients who are supplementing with vitamin D, and were given supplements before they came in, I didn't really see that as predictive of how well they were going to do. And to me, what I sort of saw was people getting much, much better when they got out into the sunlight. So I believe that there seems to be, at least if I were to look at vitamin D and the other aspects of sunlight that work, like like infrared radiation and the mitochondria and all those things, I would say that probably the sunlight itself is doing a lot of the heavy lifting. And the vitamin D is a marker for those people that are getting out into the sun and getting the benefits from top to bottom of sunlight in every aspect.
But can you get enough vitamin D if you do go in the sun for what you said to around 15, 20 minutes a day? Would you get enough?
Yeah, I've seen some charts that looked at not only where you were on the planet, but also the type of skin color that you were. And looking at it even in the wintertime, getting out there for 15, 20, 30 minutes, if you're lighter skin, should be enough to get all the vitamin D that you probably need. If you believe that you are deficient, or if you are deficient, by all means supplement. But I would hate for you to think that simply by supplementing for vitamin D that you don't need to go out into the sun. And then the other point I would say is if you do supplement, make sure you get tested to make sure that it's either not too high or too low.
What's the biggest myth that people are being told about vitamin D?
I think it's two extremes. I think the biggest myth come from two different places. There's two myths. One myth is that all you need is vitamin D. And if you just get enough vitamin D, you'll be fine. You'll be impervious and you will be a Superman and nothing can touch you. That's a myth. Okay. The other aspect of it is that vitamin D is useless. It's just good for bone strength. It has no impact on immunity. And these are usually the two extremes that we see. What I like to try to remind people is, look, I work in a hospital. I'm not a surgeon, but I've been in the operating room. And there's a lot of things that we do in an operating room to make sure that infections don't happen. For instance, we sterilize the equipment. Now, is that the only thing that we do? No. We also make sure that the humidity and the temperature in the operating room are just right. We make sure that everybody washes their hands, they scrub in, they use sterile gloves, they wear a mask when they're operating. So in other words, there's a number of different ways that we can make things more efficient and we can make things better in terms of our immunity. And I would never try to focus on just one aspect to say that if you do this well, this is the only thing that you have to do. There are some people that believe that the only thing they have to do is have good vitamin D levels and they will be impervious to anything that will ever happen to them. Completely false. There are so many other things. It's like saying, so long as you put 92 octane in your car, you never need to change the tires. You never need to rotate the tires. You never need to change the oil or change the oil filter. No, we're a complex system. Cars are complex. There's many things that you need to do to keep those maintained, and the same thing for our body.
And would you say avoiding sun is actually more dangerous than getting any sun?
That's a good question. So look at the Swedish study that was published back in 2016. They looked at 30,000 Swedish women living in Sweden, obviously, and they tracked them for 20 years. And they asked them this question. They said, do you avoid the sun? Are you go out in the sun? Or are you avidly in the sun? And to be someone who is avidly in the sun, they had to basically sunbathe when they went on vacation or on a ski trip, use tanning beds, and all sorts of these things. So these were women in Sweden that really got out into the sunlight versus those that avoided it. And then there was this group in between that was kind of in the middle. So they followed them for 20 years and they found that they sorted themselves based on mortality. So the highest mortality was in women who avoided the sun. And the best mortality, the lowest mortality, was in those women that avidly went into the sun. What was interesting there was a dose response curve to that, meaning that the more sunlight was in their lives, the less and less was the mortality. And how much of a mortality are we talking about there? It's very interesting. Those women who avidly went out into the sun, sought out the sun, sunbathed whenever they could, and smoked had the same mortality as those women that didn't smoke but avoided the sun. So that was the magnitude that we're talking about there. That study, by the way, was repeated not too many years later by Richard Weller, a dermatologist in the University of Edinburgh in Scotland. And it was a UK Biobank study, 10 times the number of subjects, both men and women. In that case, though, he asked them about solarium use, which, of course, is, these glass ports of your home when you go out and you're under
They're
glass.
banned here in Australia now.
They're now banned.
Yeah.
I used them a lot when I was younger.
Yeah, they have the solariums there in England. And the other thing that they measured was shortwave radiation, basically ultraviolet light. And they found exactly the same results. Those that had higher solarium use and higher ultraviolet radiation had lower all-cause mortality, lower diabetes, lower mortality from cardiovascular disease. Now, the question that they asked, because it's Richard Weller, well-known dermatologist, he was interested in looking at this. What about the incidence of melanoma?
And especially in Australia, that's a big thing for us.
Absolutely.
And it's like, that's all we talk about. It's like, that's why you slip, slop, and slap. And it's because of melanoma.
Yeah. So the melanoma aspect, now, of course, again, these are men and women in England. So obviously a little bit different ultraviolet exposure than you're getting in Australia there. But they found that there was there was a slight trend to increase in incidence of melanoma, but there was no statistical significant actual difference in those men and women in those categories. And they found that there was a statistically significant reduction in non-skin cancer mortality overall. Mm-hmm. So clearly, and this study prompted Richard Weller to write a review to the Journal of Investigative Dermatology. This is one of the major dermatological papers where he said, look, He even actually cited Australia. He said even the societies, the dermatological societies in Australia are saying, look, we recognize that there are benefits to getting out in the sun, and we need to weigh the risks and benefits rather than just talking about the risks of sunlight. And he ends up basically saying what the title is of his paper is, look, we ought to take note. And that's the title of his paper, Sunlight, Time for a Rethink. We ought to take note. So I think it's a great review. If you're interested in looking at that, people who are inclined to really dig down into this, Richard Weller, Sunlight, Time for a Rethink, Journal of Investigative Dermatology.
If you're listening to this podcast, chances are you care about feeling confident in your skin. So this is something you're going to love.
It's Olay's best red duo. You get 2 times plumping power when you pair the new Ultra Firming Serum, which is this one here, with their Super Collagen Peptides Moisturizer.
The Ultra Firming Serum is so lightweight, but so powerful. From day one, it starts working to firm and smooth your skin. And it gives you 5 anti-aging serum benefits in one. Fewer lines, firmer skin, refined pores, smoother texture, and deep hydration.
Then you lock it all in with the Super Collagen Peptides Moisturizer. It's soft, nourishing, and contains 25 times more collagen than Olay's Control Formula. In just 28 days, it visibly lifts sagging skin and reduces deep wrinkles.
Grab Olay's best red duo now at Chemist Warehouse. You'll thank us later.
Sure will. Mm-hmm. And I think the most important thing is we're not saying not to wear sunscreen, because if you are out in the sun for 5-6 hours a day, you definitely want to be wearing the sunscreen. I think, are you more saying like you've just got to get that right amount of sun and then make sure then you put sunscreen on, or do you put it on and then hopefully sun is getting through that sunscreen? Like, what would you recommend?
So this is what I would say. If you were to look at, if I were to sort of graphically put it out in terms of the magnitude, how much ultraviolet light we are talking about, which I really think is one of the main things that we're missing. This is how much ultraviolet light you're getting right now staying inside the home. This is how much ultraviolet light you get in direct sunlight. Okay, this is how much ultraviolet light you're going to get if you stay in the shade, if you cover up with all of your clothes and wear a broad-rimmed hat, and you go out early in the morning time. So in other words, you can really avoid a lot of the damaging rays of the sun if you get up early in the morning as the sun is coming up, get out late in the evening as the sun is going down. There's not a lot of ultraviolet light at that time. If you wear a lot of layers of clothing or a single layer of clothing and a broad rim hat, if you like, even put sunscreen on if you want. Ultraviolet light can go through sunscreen. You are going to get a tremendous amount of infrared, especially if you are surrounded by trees. Actually, I took a picture and I posted this on social media. I'll need to get it to you. I took a picture of a nice little area of the garden in my backyard where it's shady and the sun is not directly there. You could literally sit there and you would really have no fear of having any kind of a sunburn, even if you had the most fair skin possible. And yet, when I take an infrared photograph of the amount of infrared light that's coming to that area, you would be astounded how much infrared light you could get just sitting in that type of an environment.
Yeah, it's incredible. I mean, I have my little spot in my garden too. So that's good to know I'm doing the right thing.
Yeah, I mean, it's the key here is getting outside. If you want to stay under a tree, if you want to stay in the shade, if you want to put sunscreen on, if you want to wear a wide hat, if you want to wear clothes covering up your arms and legs, by all means do that. But the key is that you're not going to get any infrared light unless you get outside.
Can you store sunlight for winter, say?
Not really, but here's the good news. Even in the winter time, and correct me if I'm wrong, but my understanding is that kind of the average lows in Sydney in Australia in the middle of July, which is wintertime, is we're talking 60s, right? I guess that's Fahrenheit. That would be more like 10, I guess. 10 or 15
10,
degrees.
11, depending on where you are. In Sydney, it's probably 12. It can get up to 16.
Yeah. So in most places of the United States, when you're talking the dead of winter in December, you're talking much colder than that. And so we're sort of forced to wear a lot of, even in California, I live at about a mile up here in Southern California. I get snow. I get the 4 seasons. I get the fall, the leaves fall off. We get cold winds. We get ice, all sorts of things. So in Australia, where you are, I mean, your winters, it would seem, at least in Sydney. I know that, in more of the areas in the south, you probably have much worse winters. But you could probably get away with wearing 1 or 2 layers of clothing. Yes. And you could probably get outside when the sun is up and get that beautiful infrared light. One of the things that I noticed, I just saw this one day when I was here at my house, and we had snow on the roof and the sun was up. As the sun was hitting the snow on the roof, there is infrared light. It's going into the snow. It's melting the snow. This is the reason why snow, unfortunately, melts in the wintertime and then refreezes at night. And you get black ice, and people die from the accidents from black ice. The reason why that happens is because the infrared light, even in the wintertime, is so powerful that it's actually able to melt snow. What I noticed is the snow on my roof, the sun hitting it. As soon as the sun went down, I could see it dripping. As soon as the sun went down, the temperature did not change. It immediately stopped dripping. The melting snow immediately stopped. And so it was clear to me that it wasn't the temperature that was melting the snow. It was the irradiatant infrared light from the sun that was melting the snow. And it told me something very important. And that is that you can get plenty of infrared beneficial light in the wintertime, so long as you're out there to try to get that infrared light. Look, the reason why non-infectious and infectious diseases spike in the wintertime, both in the Australian area and also in the Northern Hemisphere in their respective winters, is because there's less sunlight and we are less likely to get outside for that sunlight. We work in office buildings. We work in office buildings with glass that block infrared light. We work in office buildings with bulbs that are LEDs that have no infrared light. We drive in our cars that we get out of our garage to the garage where we are working. We go inside, we stay there, we work all hours in the wintertime, and then we come back home again. And it can be weeks that our body doesn't actually see the sunlight. And we become just like that boy that we talked about in the story, where he's in the hospital for literally a month on end with absolutely no exposure to sunlight. And if I were to show you the graphs that we see of all-cause mortality, whether it's heart disease, kidney disease, influenza, you name it, it all spikes. Everything together in concert goes up about 1 to 3 weeks after the shortest day of the year, and it reaches its minimum about 1 to 3 weeks after the longest day of the year.
Yeah, that's why you said, I believe in the podcast about COVID, the last people to get COVID, was it Greece? Because they experienced winter last.
Well, yeah. So in the autumn of 2020, we all know that COVID hit northern Italy first, because that's where it first came. And that was from February to July of 2020. But as we started to get into the fall, and as the sun started to descend away from the northern hemisphere and start to come down to you guys in the southern hemisphere, the seasonal spikes that we saw first started in Finland, which is the first shadow as that sun is coming down, and the last one was in Greece. You're absolutely correct.
I want to talk about, because you mentioned mitochondria before, and I notice when the sun comes out, when it has been winter and it's less sunny, my mood just perks up. What is happening when the sun comes out, and why does it boost our mood like that?
Well, the theory is that the sunlight is hitting the back of your retina, where there are these intrinsically photosensitive retinal ganglion cells. Let's try to say that 5 times fast.
Yeah, I don't think I could say that once.
No,
IP, intrinsically photosensitive retinal ganglion cells. So these things are usually in the lower portions of your retina, which means that it's the upper visual fields that will stimulate them. And they project right back into the brain in this place called the perihabenular nucleus. And this is the reason why that people who are not getting enough sunlight stimulation, especially in the morning time, can be susceptible to something called seasonal affective disorder. They just feel blue. They feel down. And it's not until springtime comes around that they start to feel better. They get out of their doldrums. One of the most effective ways of combating that, this is multiple meta-analyses and multiple studies that have shown this to be the case, is to sit down in the morning time, have a sad light in front of you, 10,000 lux, sit in front of it for 20 minutes, about 30 centimeters from your face. You can even buy glasses, by the way, that can do this. So you can be moving around and taking care of things in the morning time, so it doesn't, keep you tied up there in front of the light for 20 minutes. Doing this on a daily basis has been shown dramatically to reduce the incidence of seasonal affective disorder.
That's why I get up in the morning every morning, because I've got early morning sunlight. Usually gets up on the Gold Coast around 4:30, 5.
I thought you were about to say because you've got kids.
No, they're actually pretty good sleepers in the morning. But yeah, straight away, just get up, get the sunlight on my face. And I find I have a much better day because of it. So that's, good to know.
It's well known. Not only will you have a better day, you'll have a better circadian rhythm. And the studies show, the data shows that you'll have a better night that night because you will have a higher melatonin onset peak because of the centering of that circadian rhythm. You'll have a good cortisol peak, which is what you want. You don't want a generally increased cortisol. You want a nice peak to set things off in the morning, and getting sunlight is very beneficial for that. And you'll also have a very nice melatonin peak at the end of the day. So one of the first things that you can do to having a good night's sleep is to get up that morning and expose your eyes to good light. Now, that doesn't mean looking straight into the sun. It just means getting outside and getting that light. And it's really important that people understand this because people will try to compromise on this. They'll say, well, the window's open, or, well, I've got my lights on. If you were to measure the lux or the amount of light in your room, in your house, in the morning when you turn the lights on, it's about 100 lux. Okay. If you were to go outside on a bright sunny day, we're talking 100,000 lux. So 1,000 times brighter, which means that you will get the desired effect if you go outside 1,000 times faster than if you were inside the home.
So what role does mitochondria play in skin repair and collagen production?
The mitochondria produce energy. And what we have found that as we get older, as we age by about 40 years, there is a reduction in the output of that mitochondria by about 30 to 70%. So can you imagine the amount of energy going to your home is cut by 30 to 70%? I recently had the power come off. We almost didn't do this podcast because I had no power. So imagine that happening in the cells of your body. You're going to start to see problems. I mean, dementia, the root cause of dementia is mitochondrial. The root cause of cardiovascular disease is mitochondrial. The root cause of syndrome X. I could name off a host of diseases that are listed on the Cleveland Clinic website that shows you each one of these has at its core an issue with mitochondrial dysfunction. And so, in fact, there's whole hosts of research right now going on trying to reverse aging, looking at the mitochondria. So what we found, and again, this paper from 2022, Scott Zimmerman, Russell Ryder, they showed through multiple sources, multiple references, that when this infrared light is able to penetrate through most of your body and actually affect changes in the mitochondria, it actually causes the production of melatonin. Now, this is not the same melatonin that we are producing in the pineal gland of our brain when we fall asleep. It is the same melatonin, but it's coming from a completely different source. It's coming from the mitochondria themselves in the cells. So why would this be important? I want you to think about this. Think about the mitochondria as an engine in your cell, an engine in your car. So the engine in your car makes locomotion, but in the process of doing that, it makes heat. Your engine becomes very, very hot. And it has to have a cooling system. And that cooling system is the radiator, it's the oil pump, it's all of these things that are there to cool down the engine to make sure it can continue to run. If you didn't cool down your engine, it would become very inefficient at first. And if it continued, it would seize up eventually and it wouldn't go anywhere. This is the same situation that happens in the mitochondria. The mitochondria, in the process of making energy, it produces something called oxidative stress. Oxidative stress creates these molecules which are very highly reactive, and they appear right around the mitochondria. If you don't deal with those reactive oxygen species will damage the mitochondria, and so it will become worse and worse and worse in terms of production. And so it's kind of like running your engine without oil. That's what happens when you run your mitochondria without these cooling systems that can reduce oxidative stress. Well, as it turns out, melatonin, which is produced in the mitochondria at the stimulation of infrared light, is a very, very powerful antioxidant. And so what we think may be happening here is that the mitochondria in patients with diabetes, in patients with obesity, are running ragged. They're like an engine that's running hot. And if you think about this, this is exactly what happened in COVID. I had a lot of patients in my hospital, in my ICU that I was taking care of that were diabetics, that were high blood pressure, kidney disease, dementia, older people. These are the bulk of the patients that I was seeing with COVID. So what I believe happened was this, is COVID, the virus COVID, SARS-CoV-2, when it attaches to the ACE2 receptor, which we all know about now, ACE2 is not just a receptor for the virus, it's also a mitigator of oxidative stress. It's designed to cool the engine down. And so when the virus hits this ACE2 receptor, now everybody's engine runs a little bit hotter, okay? Or it's like you're going up a hill. So imagine you have a whole bunch of cars. These are people. And everybody's engine runs at a little different temperature. Some people have very good engines. They've changed the oil. They've made sure everything's running well. The radiator's running well, and their engines are running exactly where it should be, nice and cool. They come up to this hill called COVID-19, and they go over it very easily without a problem. Other people's engines are a little bit hotter. They've got a little bit of obesity. They've got a little bit of dementia, maybe some diabetes, and their engines are still running. They're not running well. They're running a little bit hot. And now a big hill comes up called COVID-19. What's going to happen? As they start to go up that hill, it's going to get a little bit hotter. And finally, they're going to overheat. They're going to be pulling off to the side of the road. Steam is going to be coming out of the engine, and they're stuck. This is what I believe happened during COVID. And I believe it's also one of the things that happens in terms of longevity. And it has to do with wellness and all of these things. People have a huge problem today with oxidative stress. If you look at high fructose corn syrup, oxidative stress. If you look at COVID, oxidative stress. If you look at diabetes, oxidative stress. So what are the things that can reduce oxidative stress? I'm not going to put everything on one intervention, but I can tell you this, that infrared exposure, sunlight infrared exposure has been shown absolutely to increase melatonin, which is an antioxidant, and it reduces reactive oxygen species and oxidative stress.
So are you saying that by improving our mitochondria, potentially we can help reduce or slow down aging?
Yeah, I mean, or the effects of aging. I mean, let's look at that study. Let's look at the study again in Sweden. Let's look at the study there, the UK Biobank. They died less. So that's the best way of measuring aging that I can possibly imagine. If there's an intervention that reduces death, that's probably got to be the best way of measuring aging, because people die at a specific age. And if we can prevent people from dying, I would imagine that's a surrogate for reducing aging. Absolutely.
What if we want a bit more sort of superficial aging in, say, the skin and how our skin looks? Because sometimes when I think, oh, okay, I've got to get out in the sun, but for me, I start to see those sunspots or age spots, whether or not they're coming from the sun or if they're something that is coming from the inside. What can we be doing on the outside or the inside to sort of better age, I guess, on your skin or from the outside? From
a cosmetic standpoint, yes. I understand what you're saying. So remember that let's talk about skin, right? Mm-hmm. First of all, I want people to understand that infrared light penetrates through the skin. So there's aspects of the sun that go right through the skin, right into the body. But since we're on that topic, it has to pass through the skin to get into the inside of the body. And one of the aspects of age is the skin's suppleness, its ability to hold itself. And that is a direct result of something called collagen. We know this because people get collagen injections, right? Collagen injections are what people get to make sure that they look well. And it's because it's like the skeleton that holds things together. When you don't have a lot of collagen, the skin starts to thin, it starts to sag. These are all things that occur. Well, guess what? It takes energy to produce collagen. And that energy comes from mitochondria, which is in the skin. So that infrared light, if it can upregulate the mitochondria in the skin, in the dermis of the skin, it's going to produce better, more collagen. And that collagen is going to have a denser look. This is the reason why people wear those masks with the red light. It's that red light, again, that is causing the mitochondria to become more metabolically active and to reduce oxidative stress so it can improve the output of ATP and produce lots of collagen.
And what are your thoughts on those LED masks?
Well, I believe that they are a symptom in a sense of our inability to get outside into the infrared light. Imagine this. We live in the modern world. We don't play outside anymore. Our kids don't play outside. They go inside and they're on iPads. So they're not getting infrared light outside. They're staying inside. They have windows now that block infrared light, so you don't have to cool down the inside of the house and use as much energy. We have bulbs that don't give us any infrared light. And so what's happening is that we are aging faster because we don't have infrared light. So now all I have to do is introduce a mask that gives infrared light, and I'm going to get a wonderful effect because I'm putting it into a population that's basically bereft of infrared light. I mean, imagine this. Imagine you're on a British ship 300 years ago, and you're looking around and everyone's gums are bleeding and people are very sick. And you pull out a lemon. You're like, look at this miracle fruit. You just suck on this lemon and all of your problems go away. And you're like, can this even be real? It is real because everyone has scurvy because they've got no vitamin C in their diets. And of course, limes and lemons, as we used to call them, limeys, right? These are the British sailors because they discovered this fact that their diets were horrible in vitamin C. Well, let me tell you that the scurvy of the 21st century is a lack of infrared light. And so for many people, yes, those types of filters and red lights and LEDs that you can put on your face are actually going to have an improvement. But if you were to just go outside and spend 15 to 20 minutes outside, I would be surprised. I don't know if they've done the study, but I would be very surprised if these masks and things of that nature have any effect on human skin because you're going to get plenty of infrared light in that environment. And what we've seen based on the work of Glenn Jeffrey, again, keep bringing him up, he's done some great work, is that we see benefits lasting up to a week from just 3 or 4 minutes of red light into the retina, where it can have actually that's kind of a change for that period of time. So I guess it's the patient population. If you're somebody that's going to be avoiding going outside in the sun, despite everything that we've talked about today, you want to avoid the sun, you don't want to go outside at all, you want to stay inside, you are an inside creature, and you want to continue that way, realize I think there are some detriments, there's some risks to that in terms of your whole body, but I think you would definitely benefit from any kind of infrared light that you're getting, especially one that you put on your face. On the other hand, if you're someone that is listening to this now and seeing some of the evidence and now want to get outside and get some infrared light naturally from the sun, even in the shade or wearing a broad-rimmed hat or putting a couple layers of clothing on or sunscreen, I don't know if you're going to get benefit from that type of a device because I think it's giving you the same thing that the sun is giving you.
Sounds like it can save some money then. What role
Absolutely.
What role would vitamin D play in slowing down aging and improving skin health?
Well, there's been a number of studies looking at vitamin D. There's a randomized controlled trial looking at vitamin D that showed that it reduced autoimmune disease. So to the degree that autoimmune disease makes you older, there's a benefit there to vitamin D. Dr. Martineau published many years ago, probably 5-10 years ago now, showing that vitamin D supplementation reduces the effect of or reduces acute lung injury or acute lung disease or infections. So there's definitely some benefits in terms of vitamin D. It's like a hormone. Some people like to recommend taking vitamin D with K2 because it helps with calcium metabolism. This is just another vitamin that a lot of people take it with. This is not to be confused with vitamin K, which can have a issue with blood thinners. But I guess anytime you take a vitamin, make sure that you check with your doctor to make sure it's okay to take. Vitamin D definitely has some benefits. The immunity, there's vitamin D receptors in white blood cells and immune cells. So making sure that your vitamin D is where it should be, making sure it's checked, I think those are all very good things.
Now we've got so much to talk about. I think we're almost running out of time, but you talk about the 8 pillars of health, and there is so much more we could talk about, and there's so much more I wanted to talk about. But one thing you do talk about is heat and cold, or heat therapies and cold therapies. Can we talk a little bit about that and the importance of them?
Yeah, this is very important. It all boils down to a part of our immune system called the innate immune system, which the major arm of that is something called interferon. Interferon is a protein that is made by your immune system that has nothing to do with the type of virus that you have, only that you do have a virus. So the body is able to tell the difference between something that should be there and something that should not be there. And that's really important when you think about the issues that we had with SARS-CoV-2 mutating. That would make a difference in terms of the antibodies that we made against that virus, our own antibodies. But it would not matter when it comes to interferon. That's important to understand. So interferon has been shown to be very, very beneficial in terms of preventing a lot of the bad outcomes with viral infections just in general. It's what we used to use to cure hepatitis C, a virus that we thought was completely incurable. We were able to actually do that. It's the effect of the innate immune system. And here's the real key. It can be secreted at much higher levels when there is a fever in the body. Okay. So temperature is key to activating interferon. So what does that mean? It means that when I come across a patient that has a fever, I'm less inclined to treat that fever just based on the number. Unless, of course, that fever is going to cause complications down the road, like, for instance, seizures or fast heart rates or, basically losing consciousness, things of that nature. If we're talking about a fever that's 39 degrees, even up to 40 degrees, 38 is what we would call a fever currently. But even at 37 degrees, when you go from 37 to 38, many of the regulatory enzymes in your body are activating the innate immune system to produce interferon as a way of getting to that virus and neutralizing that virus. What's very interesting is that if you study these viruses, all of these viruses that we have to deal with today, they all have defense mechanisms against interferon. They know that if they have any way of trying to infect the human being, they have to have an answer for interferon. And so a lot of these viruses, and SARS-CoV-2 is no exception, it neutralizes interferon in a way so that it's continuing to fight for days and days and days on end until the immune system kicks in with the adaptive immune system and these patients end up in the hospital. This is the reason why we had people burning for 7 days and then just completely falling off the face of the earth and getting into the hospital with rip-roaring pneumonia and getting on a ventilator. That window period of 7 days at the beginning was sort of the golden week where we had a chance to sort of turn the table on this. And so what we see during those 7 days, for instance, in the case of SARS-CoV-2, is the virus suppressing interferon. So I sat and thought about this, and the question is, what can we do to improve the outcomes in these patients, improve their interferon? And actually, there was a paper that was published in the New England Journal of Medicine, and they gave a one-time dose injection of interferon to these patients with COVID-19. And what they found was it reduced hospitalizations by 50%. It reduced the complications by 50%. It was wonderful. And so I began to think, is there a way that we can increase interferon on our own without an injection? Like, let's say we had an issue with supply chain, right? And there is, and it has to do with temperature. So increasing the body's temperature can actually stimulate the body to make more interferon that can somehow turn the tide against the virus and actually get an infection cured. So I looked at this historically, and there was a number of sanitariums here in the United States, in the Northeast of the United States, the last pandemic in 1918, that actually used this technique of heating up the body. It was called hydrotherapy. And they used water because water has a very high specific heat, meaning that you can put a lot of energy into it and it reduces it or it increases its temperature slightly. But then if you use that hot water on somebody, it can transfer a lot of energy and heat the patient up without dropping its temperature too much. But they used this. These were Seventh-day Adventist sanitariums in the Northeast of the United States that used this technique of sunlight, fresh air, hydrotherapy, and they had much better results, about 1/6 the mortality rate that the regular U.S. Army hospitals had in dealing with the pandemic. And this wasn't just done in isolation, by the way. There was a Austrian psychiatrist by the name of Wagner Joreg, who noticed in his insane asylum, this is before penicillin, that people with neurosyphilis actually improved in their symptoms when they had a fever. So what he did was something amazing. He took people with malaria, took the blood out of people with malaria, injected it into his patients so that they came down with malaria. Of course, they got very high fevers. The high fevers get this, cured neurosyphilis. This is the first time this has ever happened. This is back in the 1900s. Cured neurosyphilis. And then Dr. Joreg treated these people with malaria with the known treatment at the time, which was quinine, and he cured them. And for this work, he actually won the Nobel Prize in medicine in 1927. This was well-known information back in the 1910s, 1920s, that increasing the body temperature was a great way of enhancing the body's immune system to deal with viruses and things of that nature. So I actually use this myself. If I'm coming down with anything, I'm in the spa, I'm in the sauna, I'm making sure I'm doing hydrotherapy, because if we can get interferon levels up quickly and safely without burning the patient or elevating their temperature too much, we could have a much shorter course of that viral illness.
It's crazy because we're kind of taught to just give Panadol or Nurofen, bring the temperature down, but it sounds like keeping warm or even getting out in the sunlight, having the temperature there, that's actually great for helping fight the virus.
Yes. And this is not that controversial. I think more and more scientists and more physicians who are smart, looking at the data, will realize that that treating a fever for no other reason than the fact that it's a high temperature makes no sense. We've
got kids as well. And that's always the first thing that we do is give our kids Panadol and Nurofen.
It is hard though, because you do also, like, whether or not is it like a couple of days that you will get better faster? So it's like, do you take that Panadol or something just to mask the temperature and the feeling? It might last a little bit longer, or do you just like knock it right on its head straight away and you're just really, really sick for that short period of time? It's kind of like, is that you weigh up the options in that way?
Yeah, I mean, it's a good question. If you look at what the U.S. Army hospitals did during the 1918-1919 pandemic, they used high doses of aspirin, which had just come out on the market. It was just invented in Germany in 1899. And I'll admit they were using pretty high doses of aspirin. What was aspirin doing? Aspirin was taking away the body aches. It was taking away the fever. And they felt that this was really what was killing the Army recruits when they came back from World War I with this pandemic. Well, it was so bad that there was a saying that came out of that, which was the German Bayer aspirin killed more servicemen than the German bullets did. Mm-hmm. And so it was not good. We probably overused aspirin, but if you look at today, even today, we have studies that show that if you treat fevers, that it can actually prolong illnesses and prolong the complications of illnesses. And it would sense because the fever is there to activate the immune system. And if you take away that activation, it's like basically, let's say you're in a forest and you've got a bell tower looking for fire. What do? If you mute that bell tower, which is what a fever is, it's basically a signal to the body that there's an infection that needs to be fought. You're going to have a delayed response, and you're going to lose more of that forest.
What about the opposite, like cold baths and doing the opposite of heat therapy? What's the benefit of that?
Yeah, actually, that's a very good question in the sense that that's exactly what part of hydrotherapy is. So the purpose of hydrotherapy is to increase the core body temperature and stimulate the immune system. So if you were to go through the protocols of what they would do in these patients in the Northeast of the United States at these sanitariums, is they would put hot towels on the patients, heat up the body temperature, wait for them to sweat. And at the end of about 20 minutes, they would take that off. And believe it or not, they would put their feet in ice cold water. They would take a rug and they would basically rub their chest with this ice cold water. So the question is, what was all this about? Well, the cold water would cause vasoconstriction, we believe, of the peripheral vasculature, preventing that heat that they had just spent all that time, 20 minutes building up, from escaping off of the body. So that vasoconstriction prevents that blood from flowing to the surface where you lose a lot of it. The other thing that vasoconstriction does is it demarginates on each blood vessel, there is a cadre of white blood cells around the periphery of that blood vessel. And when it constricts, it knocks those white blood cells, which are, soldiers in the battle, off into circulation. So you have more circulating white blood cells to do the job that you need to do. So that's where cold water was used. Now you may be asking, what about just putting these people into cold water to begin with? I haven't seen a lot of studies on that I would not necessarily recommend it based on what I've seen on the data for interferon, which clearly shows that an elevated body temperature can increase the secretion of interferon by tenfold when you increase the body temperature up to 30, 38, 39 degrees Celsius.
Is there anything that you think that's really important that you'd like to speak about?
Yeah, I think really quickly, my philosophy on all of this, I mean, I'm a practicing physician. I work in the intensive care unit. I talk about these natural things that you and I are talking about, but I also use medications. And I think if you start to think about things holistically, we're a bunch of links in a chain. And all of our links are organ systems. And sometimes we get into trouble where one organ system is about to break. And what we'll do is we'll use medications. All medications do is simply leverage the other links to strengthen the one that is weakest. That's really what happens. Every medication has a side effect. Sometimes we need to use it to save a life. Sometimes we get stuck on it. And I don't like when we get stuck on medications because you're always leveraging one link against the other. The 8 laws of health, which you mentioned, are the way I like to strengthen all of the links. And if you do that, sometimes you don't need to continue to take medications. When to stop those medications really should be in conjunction with your physician. So if you do all of the 8 laws of health and you find that your blood pressure is improving, check in with your doctor, see if you need to stop some of those medications. That would be the way to do it. What are those 8 laws of health? Nutrition. N is nutrition. E is exercise. W is water. S is sunlight. T is temperance. That means refraining from drinking a lot of these alcoholic beverages, which can be toxic, refraining from smoking, which can be bad for your lungs. I see a lot of complications from those things. A is air, fresh air. R is rest. And that is not only a nightly rest, but also a weekly rest where you can put away things and sort of relax and start thinking about things that you're never allowed to think about when you have social media and phones. And then finally, T is trust in a higher power, trust in God. There's a lot of research that people who have a security community to talk to and to be with and community and things of that nature have less stress and anxiety, and that can be very important. I would say, just briefly wrapping up, that probably 60 to 70% of all the illnesses that we have in the world are related to some violation of those 8 laws. Together, they spell NEWSTART. There's a university here in California called Weimar University that sort of copyrighted that term. But of course, the things that they stand for are not copyrighted and anybody can practice those.
No, that's perfect. Great advice and great way to end this episode. Thank you so much. The last question we ask every guest is, what makes you feel confident in your skin?
In my skin. What makes me feel confident in my skin? I think that from a practitioner standpoint, it is evidence that the things that I'm talking about work and that we actually have randomized controlled trial data that shows that it works. And I think that a lot of these things are redundant. The truth is redundant. And so I think that's what makes me confident to be able to say these things to you, to your guests, and to the people who watch your program.
Amazing. Thank you. And where can we find you, on social media or your website?
Yeah, there's a website called medcram.com where we put a lot of our videos, and we also have continuing medical education credits for people who are providers. And also on YouTube, just regular MedCram on YouTube, where we also put a lot of our videos as well.
Great.
Thank you so much. It's been really insightful. Thank you.
Thank you so much.
Appreciate it.